Whenever I meet a patient who's been recently diagnosed with DCIS, one of the first things I explain to her is that this is not life-threatening. The DCIS, they have found something that is super, super early where they can potentially intervene and prevent something from happening 5-10 years later.
The most important thing for a woman with DCIS to understand is that it's an overall favorable prognostic breast cancer. It's an early stage breast cancer without the potential initially for spread, and in that sense it's the best diagnosis if someone's going to have breast cancer. So the range of treatment options for a woman with DCIS range from surgical options, mastectomy versus lumpectomy, radiation or no radiation, anti-estrogen therapy or no anti-estrogen therapy, and then when one gets to radiation therapy, there are many techniques today to deliver that treatment.
Conventionally in our practice, we use factors such as the size of the lesion, whether it's completely removed, and the growth rate. Now we are able to use DCISionRT as a tremendous opportunity to really understand which patients have a higher likelihood of having the cancer cells reappear, but also importantly, whether they're going to benefit from additional radiation treatment or not.
I think people like the idea of a test that it actually gives them a numeric score and that they can look at data. I always like to share the report with the patient because I think the information, the way it's depicted there, is very, very clear.
My patients almost invariably are very excited about having the DCISionRT test performed after I explain to them that really the markers of decision making that I have are fairly crude and that they can get a test performed on their specific tumor and a score and estimated risk that is specific for them. And then with that information, we can follow up and have a conversation to determine if radiation treatment is appropriate for them.
I strongly believe that DCISionRT, now with available randomized data, should be an integral component of decision making for all DCIS patients for a couple reasons. One is we can safely omit radiation therapy in those that have a low incremental benefit. But importantly, we can also identify patients that really benefit from radiation treatment. So for me, this isn't a test that just excludes radiation. It's not, but it actually identifies patients that would really benefit from the treatment, and importantly, identifies patients where we can simply give surveillance.
I'd recommend my colleagues consider ordering the DCISionRT test for their patients with DCIS, as it's the only clinical, pathologic, and genomic platform for providing personalized decision-making for their patients with DCIS, and the only tool that's both prognostic and predictive of the value of radiation in their patients with DCIS.
Each person has a different risk that they're comfortable with too, and looking at those results on the DCISionRT report, you could have the same result and this patient can say, I want the radiation, and this patient can say, oh, is that all? Is that how low the recurrence risk is? I'm good. See you later. Everyone's different.